legislators as well as, experts and others participate in your council? Or are you gonna let the legislators do their own thing? I was wondering about Republicans working on your council.
Exactly. Well, Tim, we have invited leadership from both the House and the Senate to participate on the council. We do really want to hear from everyone, and we really want to work towards the development of the plan.
Did you get a big heck yes from Susan Wagle and Ron Reichman?
I'm not sure we've heard back from them yet.
Okay.
Governor, is there anything you plan to do from a strategy standpoint this next session after being unsuccessful last year?
Well, honestly, Stephen, I think the public is taking care of that for us. I think that they made it very clear that they want Medicaid expansion. I mean, they made it so clear that even though there was obstruction to passing Medicaid last year, there was a sign in blood commitment to debate it and vote on it this next year. So I'm very comfortable that the legislature will follow through on that, and we'll have this conversation, and then we'll end up with a good product.
Have you had any discussions with Jim Denning since the end of the session? I guess unlike Wagle, he was making comments about wanting to bring some kind of Medicaid bill to the Senate floor early next year.
Yeah, I know. Senator Denning has made it very clear that he wants to do that. I think what's most important is that Senator Denning give the members of the Senate the opportunity to vote on a well thought out Medicaid expansion plan.
You talk about this council's going to study what other states have done, and you would like to see 3 to 5 guideposts. Are those going to be relate just to the financial aspects of it, or are those 3 to 5 ideas and principles going to be broader than that?
I expect that they will go beyond just the finance. There are a lot of other innuendos within the Medicaid expansion plan that really impact both the services that people will get, but also the ability of our agency to administer the plan. So there will be a number of issues outside of just money.
You mentioned the mistakes that other states have made. Is there anything specific, any big mistakes that you've seen that you don't want Kansas to follow?
Well, I think, there's been a lot of talk about work requirements, which I've never been in favor of. And now we have seen other states who proposed work requirements have those turned down by the courts. So, for us to go down that path would be a waste of time. There's also been talk about doing partial expansion, perhaps going to 100% versus 138% of the poverty level. We've seen that knocked down by CMS in at least 2 states, Utah and Idaho. So we are learning lessons like that, so we can just avoid, not only are they costly, but they're time consuming and an incredible administrative burden. So I think it's just as well that we do study these plans and make sure that we go down the path that will get us where we need to go most efficiently.
Governor, do you think there's any, when you think about the hospitals, one of the talking points about expansion is the hospitals struggle. Is there any more evidence that there's hospitals out there that are in worse financial shape than they were a year ago, or when you made your proposal earlier this year?
Well, we know we have a lot of issues, particularly around our rural hospitals, in that a number of them are struggling financially. And I have really never said that Medicaid expansion would be a panacea, it would solve all of their problems, but it certainly would buy some time for them to come up with different business plans, or it would be just enough to keep the doors open. So I think we have a responsibility to our hospitals to get this done, to get it done as fast as we can. If that's it, we'll call it a day. Thanks for coming.